Welcome to COVID Talks. Earlier on in this series, we had already a chance to look at India. End of March, we talked to Dr. Ravi Venkatka about the beginning lockdown in his country, a lockdown like in other countries installed to reduce the number of infections. We also saw that a number of migrant workers coming from the rural areas and working in the conurbation areas in the big cities now had to leave those cities because they couldn't make a living there anymore. In the rural areas, the number of infections fortunately has been rather low, as this is true for the whole of the country, which now has about 270,000 infections and more than 7,000 deaths. Considering the huge population of more than 1.3 billion people in India, these numbers are actually pretty low. However, there still is the problem that many people lost their jobs. And even in rural communities, there are people without income which have to be taken care of. Today, I would like to introduce to you Dr. Arun Pawade. He is a consulting physician in the rural community of Avi in the state of Maharashtra. Together with his friends from the Red Cross, they have taken an initiative to help those people in the rural area which have lost their jobs, who have no income, and need subsidies, for instance, help with food. However, this talk is about something different. India is a country which has suffered from a lot of violence in healthcare for many years now. India is not the only country that has this phenomenon, and we see an increase in violence against health institutions, against physicians, nurses, and other health personnel in many countries of the world. But Dr. Pawade himself has been victim of violence twice, and let's hear his story. Welcome, Dr. Pawade.
Thank you. It is my great pleasure to address and share my personal experience of violence from patients and their supporters against the doctors. At the outset, I wish you all good health, stay home and stay safe. The assault on doctors or violence against doctors is not new or uncommon to our country. More particularly for last 10 to 12 years, incidents are frequently occurred. It is being increased with every passing day. Why? Is a big question. And answer of the question is not as simple as expected but complex. Before dealing to that problem, it will be good to share my own personal experience of violence from patients or instigators. After completing my post-graduation and service in government hospital, I started practicing medicine in the year 1980 at Arvi, a district Wardha from Maharashtra, India. A taluka place of Wardha district and also used to go to Wardha in between week. In those days, there were only 2 to 3 doctors who had post-graduation degree in medicine and had a huge opportunity and privilege to start my practice in big cities. But I prefer my hometown, that is rural area, and render services to the poor villagers mostly. My experience with patients has been very good, and I received all the love and affections and also a good bond of relationship, which usually one doctor gets in his lifetime. But there are 2 instances in my hospital that really hurt me. One incident is of year 1977 at Wardha. One person having criminal background came with his wife to my hospital and wanted me to examine his wife on priority without having any emergency. And when he was told that he had to wait and be in queue like other patients were, but he refused and did all nonsense and assaulted me and damaged furniture. The second incident is of the year 1960 at Arvi. There is our hospital. One patient had come for some procedure of termination of pregnancy and she was admitted. On table, she developed severe anaphylaxis reaction of test dose of anaphylaxis. As per protocol, she was treated, intubated with the support of other physicians and supporting staff. But she died. No operation procedure was performed. We all were shocked by her unfortunate death. We immediately informed the relatives of the patient and also reported to the police station and sent the body for postmortem. Everything was done voluntarily and in presence of the relatives of the patient, and they were also told the cause of death and were satisfied. They left our hospital. After half an hour, one so-called political leader come with the mob of 50 to 60 persons. Most of them were having a criminal background. In my hospital with shouting, and when they knew that I was not in hospital, they immediately rushed to my residence and shouting and abusive language. There they damaged house property and did all nonsense. Luckily, police reached in the time and further incidents of assault on our life was averted. I must thank to the people and patients at RV and Varda that after the both above referred incidents, entire Varda district came to my support and observed total ban, that is lockdown. It is a good thing that service I rendered to my patients were taken note by my patients and people in my area and supported me morally and stood rock solid behind me. But at the same time, these incidents of assault shocked me when myself or my hospital were not at fault absolutely. First incident was in 1997 and second was in now 2016. During the last 25 years or more, I am continually attached with IMA, Maharashtra State as an executive member. I held the post of Vice President in 1989 and President of IMA Maharashtra State in 2008 and 9. In my tenure as a President, I have persuaded Government of Maharashtra for bringing the legislative bill to protect the doctor from assault and violence from person and instigators, which ultimately succeeded, and Government of Maharashtra made a law, that is Maharashtra Medical Practice and Personal Protection Act 2009, projecting a very good picture to relief of doctor, but reality is different. Till the date, most of the police in Maharashtra do not know the state law. There are very few cases registered under this act, despite the complaint of the victim, doctors or hospitals. Secondly, I am not having any much good information for conviction and heavy damage recovered as per this law. I am not a man of law, but I still feel that for such a person who are accused or assaulting doctors and damaging properties in hospital should be tried by special court, so there will be quick disposal, and if resulted into conviction and recovery of damage will definitely deter the person attacking doctors and hospital. Central legislation has not made to deal with violence against the doctor, and suggestions from the state have been invented. However, till the date time, has not come to effect. But this time, in this corona pandemic, government has brought this law for only for the pandemic. Soon it comes into the effect. The issue of violence against doctor will be uniformly dealt. Let us hope for everything good to happen. Instigators are the big problem and they are the main culprits in the violence, and therefore they should not be left scot-free from the law.